to the Director of CMES and SEAMEO Centers, all distinguished resource persons, Board of Directors and Managers of SEAMEO RECFON, respectable participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you. Welcome to the first SEAMEO International Conference on Food and Nutrition, Day 3. I'm here again, Izati Hayu Andari, your Master of Ceremony for today's event. Before starting the last day of our conference, we would like to remind you that more information about this event is accessible through our apps SEAMEO ICFN. We would like to inform you again that we will be tweeting live from our Twitter account at SEAMEO RECFON. Please tweet or share your posts on Instagram of your experience in joining this conference by mentioning at SEAMEO RECFON, and don't forget to put hashtag FirstICFN, hashtag virtual conference, and hashtag ECCE. We will have a prize for one best comment on Twitter or best post on Instagram that will be announced at the end of the conference today. Kindly continue to tweet and share your posts of your insights on any sessions you attended or the main points discussed by our speakers or a summary of any sessions. And don't forget to subscribe and like our YouTube channel. This conference is conducted by Southeast Asia Ministers of Education Organization, Regional Center for Food and Nutrition, best known as SEAMEO RECFON. Now, let's move on to plenary session 4 that will discuss about strengthening early childhood care and education in Southeast Asian countries post-pandemic. This session will be moderated by Dr. Jesus C. Fernandez, the Deputy Director for Program in SEAMEO RECFON. Our first speaker is Dr. Ethel Agnes Valenzuela, the Director of CMES, who will discuss SEAMEO ECCE Competency Framework. And the second speaker is Dr. Priyono, the Director of SEAMEO ECCE, who will share the implementation of scoping study on ECCE and parenting in Southeast Asia. And our last speaker, but definitely not the least, is Dr. Maria C. Dumlao from Department of Education, Philippines, who will deliver her presentation about country experience WASH in ECCE in the Philippines. We now welcome Dr. Jess to moderate the session.
Okay, good morning, everyone. Thank you very much, Sasa, for that introduction. Welcome, everyone, for our last session of this conference. I believe everyone have learned and enjoyed the past sessions for the past 2 days. We have an equally interesting topic for this morning, which is strengthening early childhood care and education in Southeast Asia post-pandemic. And like Sasa said, we have a very distinguished list. We will be giving them about 15 minutes to present their topic. And also we would like to encourage the participants to please type your questions to our resource persons using the question and answer chat box, or write direct in the YouTube chat box that you are tuned in right now. So without further ado, because we have a limited time right now for the day, as we will be having the Jumatan also here in Indonesia and the rest of Islam countries. So we would like to present or welcome the first speaker, no other than the SEAMEO Secretariat Director, Dr. Ethel Valenzuela. Dr. Ethel was the former director of the Office of Student Service, International Affairs Services in the Commission of Higher Education in the Philippines. She has served in a lot of positions, And she is a prolific writer, and a proposal development to her name are a lot of projects under UNESCO, UNICEF, and CHED, and under the Department of Education of Philippines. So, Dr. Ethel, are you ready to have your presentation? You're given 15 minutes. The floor is yours.
Thank you very much, Dr. Jess. And let me say good morning to all our participants who are joining us today for the very pioneering international conference. And I will be presenting to you equally a very important topic, which is on ECCE Teacher Competency Framework. So good morning, or good afternoon, or good evening to those who will be watching later this conference, which is actually live at YouTube. So my presentation will focus on the concepts we have developed together with UNESCO, of course, and our center, SEAMEO ECCE. So since 2017, we have worked together to develop ECCE Competency Framework for Southeast Asia, focusing actually on the teacher competencies. And let me say that with the United Nations Sustainable Development Goals as a platform for achieving quality ECCE outcomes by 2030, ECCE policymakers as well as teachers and a lot of educators would like to find out if there is anything that most of Southeast Asian ECCE teachers should have as their competencies. So this is actually a work to contribute to Sustainable Development Goal. As we know, Education 2030, goal number 4 is promoting quality education and promoting lifelong learning for all. We want that by 2030, we will ensure that all girls and all boys have access to early childhood care and development, and as well as pre-primary education, so that they are ready for primary education. In SEAMEO Education Agenda, in 2015, the Ministers of Education already have adopted our own Education Agenda 2015-2035. And as you see, the first priority there is early childhood care and education. There are still many 5-year-old or 3 to 5-year-old kids who could not go to school and could not have access to early childhood care and development and even education. So that was considered as really the priority. As we know, in ECCE, we develop fully the brain and the overall development of the child. And the second of our education agenda is on inclusive education. We have to find out what are the barriers to education and try to address so that all learners will have access to schools. So number 3, in our region, we have a lot of challenges. That's why some kids could not go to school, right? Like disasters or tragedies, social conflict, etc. So we also have thought of having resiliency, that sense of resiliency, especially during emergencies. We also promote TVET, teacher education revitalization, harmonizing higher education and research, improving the mobility of students all across Southeast Asia, and finally, 21st century curriculum. So from the minister's mind, early childhood care and education was considered as important, and this is also our new education agenda, SEAMEO 7 priority areas. So in SDG 4, we have already linked actually most of our targets and indicators and even the competencies of teachers to Sustainable Development Goal number 4. And we have thought of having quality early childhood care and education, learning experiences, which will be the bedrock of learning and development. We wanted early childhood care and education to be a strong foundation so that when they enter primary education, kids are ready. It will also enhance the academic achievement of our learners. And of course, if you have this kind of support, there will be improved social, economic, and health outcomes. And let me share with you the picture of early childhood care and education in Southeast Asia. SEAMEO, we have 11 member countries, and that is largely ASEAN member countries and Timor-Leste. So in terms of their entry of children to primary education, most of the kids in Southeast Asia go to early childhood care and education at age 3, with the exemption of few countries like Indonesia and the Philippines, of course, Malaysia, and partly some from Singapore. So, however, in terms of the official entry to primary education, most of countries in Southeast Asia have a target of at least age 6, or from age 3, 4, and 5, kids are actually in early childhood care and education, whether it is provided by private sector or daycare services, because in some countries, this is under another ministry. And early childhood care and education, kindergarten, you have 1, 2, 3, right? So all of these preparatory prep school, they have different modalities for each country. But the duration actually of pre-primary years also varies from country to country. So what we say as the mandatory early childhood care education could be at least 1 year, at least kindergarten before grade 1. But some countries in Southeast Asia, they offer more, like 1 to 3 years. So enrollment in our region in terms of early childhood care and education also varies. The population also varies, and most of our learners who are in early childhood care and education can be found in Indonesia, where almost 5 million of them, maybe more at this time. And then the second one with the most number of ECCE learners are in Vietnam, and then the Philippines. So considering the population of each countries, it will vary. And the enrollment rate is good. However, we cannot find some data from other countries. And well, that's the picture of early childhood care education in Southeast Asia in terms of access and in terms of enrollment. And however, we need to focus on who is actually contributing to quality pre-primary education, and that is teachers. Jaya, when there was a declaration to commit on ECCE. This is a follow-up action after the Putrajaya Declaration, and of course, supporting the Kathmandu Statement of Action. So, in order for us to really contribute to quality education and quality learning, we need to professionalize and develop the capacities and competencies of teachers. So, if we have all of these competencies of an ECCE teacher, because some of them are actually they're just into this, or they were hard because we don't have enough teachers for ECCE. They need at least to imbibe these competencies. So the framework will help them, guide them as well in terms of qualification frameworks, in terms of standards. But of course, this is a Southeast Asian Teacher Competency Framework endorsed by the ministers, and we have worked with some countries to mainstream this competency framework. So we have started with of course few countries and translated even this teacher competency book into some languages. This is the book that we have developed, and you can find this in our website as well. So the teacher competency framework aims to enhance the professionalization and capacity development of ECCE teachers. So this book is available in our website. And the framework covers competencies of teachers of children aged 3 to 5 in pre-primary education setting. So this book has the following domains. So you have content, knowledge, pedagogic practice, as well as assessment. So, I'm also a teacher, and the biggest thing is teachers should be prepared well advanced than the learners. But it's not only the ideas that you have as a teacher. You need to have the right pedagogy. You need to use, especially now in the COVID-19 pandemic, different pedagogical approaches. So gone are the days we have face-to-face learning at this time of the pandemic. We use video lectures like this or other modalities, gamification. You use also games, Kahoots in your classes, or you also use other modes such as you having your LMS with discussion forums, or having parents help in delivering the items for discussion. Most importantly, during this pandemic, teachers should also have knowledge on how to assess. So in an early childhood level, teachers have different ways of assessing the learners. So that is the first domain of ECCE. And the second one is the learning environment. So of course, as of now, we are very challenged with learning environment. Kids could not go to school yet, but many countries are starting to open up. And we also have to, as a teacher, you need to be engaged with other teachers, with your peers, and collaborate with them, your principals, and other partners. And the fourth pillar, or the fourth domain actually, is on professional development. So we should not forget that we need to train teachers, especially during this time of pandemic. How can they teach better using video conferencing and using all the available technologies out there? So in the digital ecology, we need to look at all of the available resources for teaching. And teachers should have training on that. So I think the four domains that we have developed before COVID are still very much relevant today: content, knowledge, pedagogical practice, assessment, learning environment, engagement and collaboration, as well as professional development. And so we have this big pie of ECCE landscape, and you can see that the heart of this competency is actually teacher. So once you have a competent teacher with knowledge of the four pillars of the four competencies we have identified, no, we have identified this with experts, not just SEAMEO and UNESCO saying this, but we gather experts from all over Asia Pacific region to actually find out the core, the most important competencies of teachers. So such as in the after the teacher, you see the circle of professional development, engagement, collaboration, learning environment, content, knowledge, pedagogical practice, as well as assessment. So the bottom line here is that in each of these, for example, number one, in your content and knowledge, the teacher should understand the child's holistic development and learning. The teacher should facilitate child development and learning. In a learning environment, you establish nurturing, inclusive, and safe environment. And it also should promote health, nutrition, safety, and protection. That the classroom you have is a classroom that the children enjoy, neat, tidy, and safe. So what is important in that learning environment is safety of children. And for professional development, we think of ensuring continuous professional growth of teachers and professional development. It should be in the school investment plan. And engagement and collaboration, there should be networking, collaboration with ECC stakeholders, engagement with parents and families, caregivers as partners of ECCE. So these are all available and free. If you're interested, you can download them from the SEAMEO website. Thank you so much and have a good day.
Well, thank you very much, Dr. Ethel, for that very informative presentation. I believe this is a very important framework for ECE teachers, and I believe there are also a lot of participants who are also into the teaching profession. It is important, and I'm very happy that you mentioned about investing on ECE teachers, because they are at the height of this function of really developing a bedrock of lifelong learning for our early childhood kids. So we now move on to the next speaker. But by the way, I would like to inform you that co-moderating with me is Dr. Wange, Grace Wange. Later on, she will be the one to be asking questions to our resource persons. And so I would like to remind our participants to keep on putting your questions in the Q&A chat box, and also those in the YouTube, keep on typing those questions. We will attend to them. We will select the questions that will be asked for our resource persons. Okay, for the next resource person is an old friend of mine, the director of SEAMEO CECCEP, or the Center for Early Childhood Care, Education and Parenting. Dr. Dwi is also handling the Education for All, a program of UNESCO and MOEC of the Republic of Indonesia. He is also a lecturer with educational leadership and management expertise. He will be sharing with us the results of the study of the Center on ECE in Southeast Asia. So the floor is yours, Dr. Dwi.
Thank you very much, Pak Jess. Today you look more handsome. Thank you very much. You look different today. Well, very good morning, Dr. Ethel, and the director of RECFON, and also the deputy director, Dr. Maria Corazon, also very good morning. And then, ladies and gentlemen, participants of the International Conference on Food and Nutrition, very good morning to all participants, and it has been an honor for me to be able to become one of the speakers in this conference. Today I'm going to present you the result of one of the research conducted by SEAMEO ECCE entitled Scoping Study on Early Childhood Care Education and Parenting in Southeast Asia. study was conducted based on the evidence base that shown in recent decades. ECCE and parenting have further received attention from the diverse stakeholders, including research communities, civil society, and intergovernmental organizations, which further understanding of its holistic and multi-sectoral nature. Ladies and gentlemen, the study collected data through literature review of previous studies and document analysis from Ministry of Education resources as the main method. Data was also collected through questionnaires sent to partner in each respective Ministry of Education in South Asia countries. Research continues to document the multi-phase development benefit of ECCE for health, for education, for social and emotional well-being, for social equity and cohesion, for the economy, and for employment and earning. Ladies and gentlemen, as it is shown in the table, these are the conditions on ECCE in Southeast Asian countries. First, the variation, category, and scope of the age of students in South Asian countries varies. However, almost all countries in South Asian region that are referred to as a students at the ECCE level are children under 6 years of age. The second, in some countries, the authority of the ministry in charge of the early childhood lies with more than one ministry. So good coordination between ministry is needed. Third, the institution that provide early childhood education in almost all regions of Southeast Asia are private organizations, with the exception of Brunei, Darussalam, and Vietnam. In several countries that are included ECCE as formal education, they ensure that they provide clear references in terms of curriculum and education delivery. Ladies and gentlemen, furthermore, on the table shown in the slide, these are the conditions of parenting in Southeast Asian countries. First, in almost all countries in South Asia region, there are programs and services for parents to do better parenting program in the family. Second, in almost all Southeast Asian region, the implementation of this program has also been supported by relevant ministries who focus on early childhood and families. Third, Malaysia is one of the countries which has sufficient program for developing parenting program. The parenting program ensures that families have sufficient knowledge and skills to carry out parenting program at home. Ladies and gentlemen, these are some issues and challenges found as the result of our study. First, providing better access on ECCE and parenting programs, especially for rural areas and marginalized community. Second, enhancing quality of ECCE program on ensuring the holistic development of children. The third, improving ECCE teacher skill and competence, since many ECCE teachers in Southeast Asia region are not qualified and not well trained. Fourth, elaborating coordination between ministry within countries who has mandate to ensure the children well-being as early as possible. About 1,000 days of life. The last, leveraging the fund for ECCE and parenting program in order to tackle the above issues, as investing on ECCE is the most beneficial for children development. Ladies and gentlemen, regardless of the limitation of resources available for CECCEP, the study is able to grasp the general condition of ECCE and parenting in Southeast Asia, though it is far from being in deep analytical study. These are the recommendations that SEAMEO CECCEP could offer to ECCE stakeholders in Southeast Asian countries. First, gather program that ensure availability for the children in the region with adequate funding. Second, implementing program ECCE teacher competence framework in Southeast Asia that has been developed by SEAMEO Secretariat to lifting up teacher quality in the region. Third, strengthening the partnership and collaboration between countries in the region to find out the best practices that proven to both either teacher competence or early childhood development program, as well as learning method. And the last, developing ECCNE, early childhood care, nutrition and education, learning model promoted by SEAMEO RECFON and SEAMEO CECCEP to facilitate the holistic integrative early childhood development program. Ladies and gentlemen, that will conclude my presentation on the result of scoping study on ECCE and parenting in South Asia. We realized that the process of obtaining ECCE and parenting data from each country is not an easy task. Therefore, the data we convey in this presentation is slightly far beyond comprehensive. The data we convey will continue to be refined according to the last data we have. In this connection, we would really appreciate if there are any input, information, and suggestion coming from you to improve our existing data. I hope that you find the information beneficial in providing input for respective policymaker to further design program at the regional level, including research communities, civil society, and intergovernmental organization, with further understanding of its holistic and multi-sectoral nature. Thank you very much for thank you very much for your attention. Good morning.
Yes, thank you very much, Dr. Dwi. That was a very interesting and very concise presentation, but packed with so much information. So, well, my look is due to the, well, anyway, I think we are very fortunate to have this kind of scoping study, because we have learned that there are a lot of ECE programs in Southeast Asia, And ECE program is not just lodged into one ministry, but a lot of ministries are working into this kind of field. And providing better access to ECE programs definitely is something that we address, because we need to train more ECE teachers. And this is also what we are doing together, SEAMEO ECCE and RECFON, continuously developing learning modules. And I think it will be taking off soon enough, Padwi, for the coming workshops and trainings that we are going to have in Indonesia. And hopefully we can scale it up in Southeast Asia. Thank you once again, Dr. Dwi, for that kind presentation. So I believe we are on track, and I would like to suggest to our participants to keep putting on your questions, because we might have ample time for discussion later on. We move on to our next speaker, my kababayan, again from the Philippines. She is Dr. Cora Dumlao. And Dr. Cora Dumlao is a resident physician in one of the hospitals in the northern Philippines, and also a family physician also on a private practice. And she has been a medical officer at the Division of Health in the northern part of the Philippines. And now she is the Chief School Health Division Bureau of Learner Support Services at the Department of Education in the Philippines. I believe she has a lot of accomplishments, but I would like to proceed on to invite her to discuss WASH experiences in the Philippines, or the water, sanitation, and hygiene in the Philippines in relation to early childhood development. So the floor is yours, Dr. Dumlao.
Thank you very much, Dr. Director Jess. To our Director of SEAMEO RECFON, Dr. Mansour, Dr. Ethel, Dr. Dwi, good morning, and to all the participants of this very prestigious event. I have the honor to share with you the experience of the Philippines, important because it is linked to improvement of the health and learning performance of children and their families. And it keeps the school environment and community healthy, clean, and safe. And it also inhibits the transmission of diseases and illnesses. It also develops good life skills among children. To understand ECCD in the Philippines, here are some laws that reinforce the support and structure for policy planning and implementation of the program for ECCD. We have the Barangay Level Total Development and Protection of Children Act, which establishes a daycare in every barangay or village. We also have the Early Childhood and Development Act, which establishes the National System for Early Childhood Care and Development, and the Early Years Act of 2013, which recognizes 0 to 8 years old as part of the early childhood education. The responsibility for 0 to 4 years old is under the Department of Social Welfare and Development, and the 5 to 8 years old is under the Department of Education. So that when we will discuss the legal and policy cover, we will focus on the DSWD, the Department of Education, the DILG, and various partnerships supporting WASH in ECCD. The Philippines recognizes the need for a national system for early childhood care and development that is comprehensive, integrative, and sustainable. And that involves multi-sectoral and interagency collaboration at the national and local levels among government, among service providers, families and communities, and among the public and private sectors, non-government organizations, professional associations, and academic institutions. The DILG DepEd Joint Memorandum Circular for Water, Sanitation, and Hygiene in ECCD establishes the support of the local government units and the national agencies and offices of the ECCD in WASH in ECCD areas. The joint memorandum reiterates the need for providing budget for facilities and programs in WASH in ECCD, and note that the partnership and assistance of the local government unit and the national government are critical to WASH in ECCD. The SDG 4, which is the insurance of inclusive and quality education for all and promote lifelong learning, and Goal 6, which is to ensure availability and sustainable management of water and sanitation for all, provided clear targets and indicators that led to the creation of a national WINS policy through DepEd Order Number 10 Series of 2016, the benchmarking of the national standards. It's titled Policy and Guidelines for the Comprehensive Water, Sanitation, and Hygiene in Schools Program for the Promotion of Correct Hygiene and Sanitation Practices among School Children in a clean environment in and around schools to keep learners safe and healthy. So the focus is on water, sanitation, hygiene, deworming, and health education. For the DSWD Administrative Order Number 15 Series of 2011, titled Guidelines for the Accreditation of Daycare Centers and Daycare Workers, it provides standards on the availability of safe water supply, functional toilets, hand washing sinks, and prescribed hand washing practice in daycare centers. Also, under the guidelines for the registration and granting of permit and recognition to child development centers catering to ECCD, it may be good to note that this provide for health, sanitation, and safety standards such as clean, safe, and sanitized environment, child-appropriate group hand washing facilities and toilets, health monitoring, wash routines, deworming activities, and integration of health and life skills in the curricula, child development learning programs. To operationalize the WINS policy, the department issued the national guidelines for WINS utilizing the three-star approach. The three-star approach is a stepwise approach to reach the national standards by defining national priorities, setting benchmarks, and rewarding achievements. The DepEd has the online monitoring system, allowing schools to upload their own assessment of WINS status. The WINS data is actually very important in the Philippines, particularly in the Department of Education, because it is used as a basis and criteria for recognition systems used for fund allocation during budget hearings and defense. For SY 2018-2019, out of 48,023 schools in the Philippines, 35,000 or 74.4% participated in the OMS, and we were able to identify who are the schools that are categorized as 3 stars, meaning they have reached the national standards, those who are 2 stars, 1 star, and those who are 0 stars. Now, in integrating WASH in ECCD, focus is on the delivery of WASH services to children in early learning centers. So there is a need to provide for water supply, sanitation, daily group hygiene activities, biannual deworming, and hygiene education. An essential health program that triggered or helped in the establishment of WASH in ECCD was the Fit for School approach. This is in coordination with the GIZ. And this approach is based on 4 core principles. There should be simplicity, sustainability, scalability, and systems thinking. And an that informed program management on various levels are critical. There are key gaps in WASH in early learning, and this includes lack of curriculum support to daily group hand activities, limited capacity for WASH messaging among child development workers. So there's a need to capacitate them on the components of WINS. And also, one of the targeted solution is a tool for child-centered approach. A precursor or early initiative to the WASH in ECCD is the WASH in Daycare Centers, or the WIND. WIND is a collaborative project of the SWD, local governments, UNICEF, and Philippine Council for Women, with support from the Australian government. The WIND targeted 1,200 daycare centers in 36 local government units, and it aimed to improve access to water, toilets, and hygiene education in daycare centers. It includes daily group hand washing and toothbrushing activity of children in public daycare centers, twice yearly deworming, and promoting access to water and sanitation as a human right. Translating WASH learning in practices is also in the WASH and learn approach of ECCD, done in partnership with the UNICEF. And this approach integrates learning concepts, exploration of skills, and applying this. And why would this approach work? Because it is child-centered and is based on the context of the child, developmentally appropriate practice. And also, it is focused on assessing the development of the child, and it involves experiential learning. It also includes participatory arts-based processes, which is interactive, and arts-based methodology is applied to make it more participatory. And it includes holistic development approaches. The availability of WASH facility in the classroom makes it possible to translate the practices on hand washing possible. Child-friendly dimensions for toilets and hand washing stations. The presence of facility promotes and enhances the behavior, and it becomes part of the routine of the center. The Wash a Lot is a prefabricated system which can accommodate hand washing, toothbrushing for up to 20 people at the same time. It allows groups of users to perform hygiene activities either together or individual due to individual water outlets. Now, there's also the importance of providing nudges to promote WASH behaviors. Nudges promote positive behavior in children and their teachers, and posters, stickers, footprints, arrows, and other visual cues are utilized. Understanding that integrating WASH behavior in child development centers and schools covering early childhood is important. This involves a holistic approach and involving multiple community and stakeholders. We already have national TWGs, regional division, and school technical working group that will help assess the implementation of the WASH in schools at specific level in the governance. We have already integrated WASH in schools as one of the flagship programs of the Department of Education under the operational plan for DepEd. The 6 flagship programs include the school-based feeding program, WASH in schools, national drug education program, health and nutrition services, and also adolescent reproductive health, including school mental health. So the Department of Education has integrated budget into the 6 flagship programs, which is being championed by nonetheless the Secretary of Education, and we continue to advocate for more support with partners. In summary, the Philippine WASH in ECCD and schools have been forged and have been founded through years of putting in policy, engaging support of national and local government and other stakeholders, partners from different sectors. It involves the need to provide for sufficient budget, resources, and facilities. Right now, for 2019 and 2020, we already have the Wash in Schools integrated in the school-based feeding program, and that all our kinder to grade 12, around 26 million learners are provided with health kits, toothbrush, toothpaste, so that they will be able to translate whatever learnings they have in actual practice. And it is not sufficient to have policies in place. Having policies is just the first step. Appropriate implementation must be coupled with developmentally appropriate nudges, integration in learning and routines, and consistency in home and school as they are prepared from child development centers to formal schools. This all remind us that WASH is a responsibility of everyone. And even in the time of pandemic, we continue to provide online implementation as well as monitoring of our programs and projects. And we engage our partners from UNICEF, GICEP, Save the Children, and other key government agencies in the implementation of the WASH in schools in line with the pandemic, and also in compliance with the required health standards of the Department of Education in times of pandemic. Thank you very much for this opportunity to share with you the experience of the Philippines.
Okay, thank you very much. Thank you very much, Dr. Dumlao, for sharing the impressive accomplishment of WASH program in the Philippines. This is really a good example of how policy and technical implementation should blend together to ensure the effective implementation of a program like this under the three-star approach that you are adapting together with the Fit for School program with the GICET. And it's interesting to know that you have another acronym to blend WASH in the daycare, and that's WIND. And this is something, again, that will be a wind beneath the wings of all the ECE teachers. And we look forward to this kind of collaboration with you. Maybe this is together with Innotech, I believe so, and GICET. Well, ladies and gentlemen, we have heard three insightful and interesting presentations from three distinguished resource persons. And I believe you have learned a lot from the presentation. So we will now proceed with the question and answer portion. And for this portion, I would like to call on my co-moderator, Dr. Grace Wange, to do the question and answer portion with our resource persons. Silakan, Dr. Grace.
I have questions now for Dr. Ethel and Dr. Dwi. So the first question for Dr. Ethel is come from Repa Kustipia, Indonesia, and she asks, how many small action for learning environment on 4 domain framework are for SEA, for Southeast Asia? And how to manage and organize the gifted children, meaning like the special needs children related to professional development program? I think the first two questions first, Dr. Ethel, if you may.
Thank you very much for the question. Yes. Well, in terms of small actions for learning environment, you can see all of those indicators and enabling competencies in the ECCE Teacher Competency Framework book. You can download it, and these are very easy to understand concepts. But however, I would like to focus on your second question regarding the children, the gifted children. So I think it's really very interesting, as well as it is an area of concern to have the gifted children in ECCE and how to manage them. As we know it by some some available researches on gifted children, we see that some gifted children have emotional intensities, and sometimes the teachers can handle these, or sometimes they are challenged by this kind of children. By the way, we have a SEAMEO Center for Special Education Needs based in Malacca, Malaysia, and they provide online training as well on how teachers can handle children with special education needs. So for my sense, I think the most important here for professional development is on how the teacher can ever build a relationship with the community, with the learner, the gifted learner, as well as the parents. So what is important is being able to understand the emotional intensities of the children. And the teachers must have that capacity to listen more and also to work with parents in this regard. There are some professional development programs for handling children with special needs. And right now we have also inter-center collaboration on developing some modules related to children with special needs and children with disabilities. So I encourage you to download our ECCE Teacher Competency Framework for all the enabling competencies that are spelled out in those domains. Thank you so much.
Thank you, Dr. Ethel. The second question maybe for Pak Dwi. Dr. Dwi, there is a question from Ibu Afita Usfar from Indonesia. Just asking, is there any specific section in the Ministry of Education Indonesia that is responsible for coordinating non-formal training for preschool children that are implemented by NGO or CSR of a company?
Well, thank you very much. Actually, we have two questions, right?
So the first question first, Pak, from Ibu Afita.
Okay. Nice question, Ibu Afita Uspar. We have a directorate in Ministry of Education and Culture that coordinating training for ECE teacher, both formal and non-formal. Is EC, I mean early childhood education teacher and teaching personnel directorate. Actually, SEAMEO CECCEP also has mandate to do improving teacher performance by doing teacher capacity building or teacher training. A few days ago, we have conducted training for teacher in Palembang district, I mean in South Sumatra. We also have offline and online teacher training. Thank you.
I hope that satisfies Ibu Afita who asked this question. I have the next question actually for Dr. Dumlao and Dr. Ethel altogether. How is the current, it's come from Maria Pan. How is the current system in place? She means the 4 pillars in the framework, as well as WASH in ECCD in the Philippines, responding to the current situation of COVID-19 pandemic. Maybe Dr. Dumlao can answer first.
In the Philippines, the opening of classes is moved in October. However, there will be no face-to-face or physical classes until there is, according to our president, until there is assurance of safety. So right now, what we're doing in the Department of Education is to ensure that there are still activities to put in place preparations for the facilities. Also, there are the provision of the PPEs, and that includes also the provision of health kits to our learners. And we also have the MOOCs or massive online course in place for our teachers that is in coordination with the SEAMEO INUTEC. We are in we are in the process of capacitating our health personnel and our focal person on WINS, as well as our teachers on the WASH in schools. That also includes our school heads. So I believe that in capacitating our advocates for school health, then we can come up with a stronger force for WINS advocacy. There's also integrated in the budget for 2019 and 2020 the health kits for kinder to 12 learners. We are about to launch again the 2020 milk feeding component, as well as the nutritious food feeding component for all our learners, even if they are not in schools. So we already have the guidelines in place.
Thank you, Dr.
Thank you.
I think in the time of pandemic, even now it's even more important to improve the implementation of WASH, and especially a concentration on these 4 pillars. Dr. Ethel, do you want to add something to that?
I think Dr. Maria Corazon already provided an answer for the Philippines. And in terms of promoting health, nutrition, safety, and protection of children, I think most schools are actually transitioning. Well, I can speak of Thailand because last week I have visited some schools who have reopened. And you will see the difference that, you know, from ECCE to primary education, they have provided facilities for washing hands, sanitation, and then also facilities for supporting the mask. So there are also culturally appropriate practices that we can see and teachers should be knowledgeable of, like providing distance for the children in the classrooms. Some countries in Southeast Asia have trimmed down the classes. In Myanmar also having like 25 kids in a classroom or something less than that, or even going for shifting just to pursue the protocols, the sanitation protocols during this time of pandemic. There are so many good practices that we can learn from, and certainly Philippines has already started with the WASH program, and many schools are aware of these sanitation protocols. So the challenge now is some schools are closing back because of the COVID pandemic and maybe the second wave. But teachers are knowledgeable now, more knowledgeable on how to prepare for the COVID pandemic. They have the guidance from the Department of Education. They have all the right resources to do it. And it's in the pillars of the teacher competency framework that they should ensure that health, safety, nutrition, and protection during this time of pandemic will be made available. Thank you so much.
Thank you, Dr. Ethel. But related to that, there's another question for you actually. So there's a question from Judianti from Indonesia. She asks, because you mentioned that teachers have different capacity and pace in assessing the needs of the learners. She would like to know if you have more information about this. So do you have the data of teachers' capacity and pace in assessing the needs of the learners? Where we can find those data, maybe that's a question.
Our SEAMEO Center, CECCEP, did a scoping study on ECCE. At this level, what we have focused on at the SEAMEO Secretariat are all policy levels, like, you know, policies that the ministers will adopt. So we have the competency framework adopted. And for the details in terms of having the variety of professional development as well as the preparation of teachers, we do not yet have. However, in the pillars for quality learning and assessment, we can see that teachers should have the right preparation to use the right methodology for the different capacities and capabilities of learners. These were even taught in the education pre-service stage, right? So, but we had completed the study only on teacher motivation, and it is linked with teacher professional development. We have also some studies about the TVET in particular. So for early childhood care education, I think, Dr. Dewey, do you have any new study from CECCEP now on the teacher professional development? If not, we can put that in our research agenda.
Yeah.
Thank you so much. That's a new idea coming up from this
Yes.
conference. That's good because that's the use of the conference. So, Pak Dwi, there's another question I think for you. So there are two questions asking about partnership and collaboration because you mentioned that in your presentation. So Repa from Indonesia asking whether it's possible to collaborate with social enterprise, community-based social enterprise. I think this is also some invitation actually, Pak. Yeah. And there's also another question asking whether SEAMEO CECCEP is actually collaborating with other SEAMEO center other than RECFON, for example, with SEAMEO ECCE. Maybe you can answer those both questions, Pak Dwi.
Yeah, thank you, Dr. Grace, for Dr. Repa, Mbak Repa. Thank you very much. Nice question. We are very pleased to collaborate and having partner as many we could. Our organization is open to cooperate with other communities as long as it has relation with early childhood education and parenting. Our scope of parenting quite diverse and range, since the parenting mandate is aimed for children start from newborn until 18 years of age children. The second question from Maria Pan. Thank you very much for your question. Nice question. Let me answer your question. SEAMEO is also one of SEAMEO center that we always doing coordination. Many online learning platform that we use also come from SEAMEO. Perhaps in the future, SEAMEO CECCEP and SEAMEO can start to cooperate in making learning model and module for teacher training. Thank you, Dr. Grace.
Thank you, Pak Dwi. So anyone who would like to collaborate, please contact any SEAMEO CECCEP, and it will directly connect with all the SEAMEO centers actually in ASEAN, yeah, right? Is that right, Dr. Ethel? Okay. So I have the last question. I think this is the last question. Is all for the three of you. It's from Dr. Rina Agustina. She's asking about your opinion and maybe your experience on combining integrated health posts, or in Indonesia we call it as posyandu for preschool, and ECE or PAUD. I think in Indonesia we already have the concept of PAUD HI. So maybe a quick round of a short answer from the three of you. What do you think about that that kind of integration, and what maybe you can share some small experience from your observation? Pak Dwi first, or Dr. Dumlao? Pak Dwi, do you want to comment first? Or Dr. Dumlao? Combining the integrated health post, which is managed by a health sector, with ECE. Is there any experience in the Philippines, Dr. Dumlao? Sorry, I need you to unmute your microphone.
Can I have the question again, ma'am?
So what do you think about combining the integrated health post, which is run by a health sector, with the early childhood education centers?
In the Philippines, there there's always areas for collaboration. We know that ECCD, when you look at the age group for ECCD, that's 0 to 4 for the SWD, and 5 to 8 years old for those under the Department of Education. And we have a strong partnership with the other private sectors. In the department, we also have the International Cooperation Office and the Partnership Division, where potential partners can come in and come up with a menu for them to support too. Like we would always look at ECCD not only on the academic requirements or educational requirements, but also we look at health, sanitation, hygiene, and capacity building. So combining the different support of the private sectors with that of the SWD and DepEd has always been the guiding principle in our actions. So if they cannot come up with the educational support, they can come up and partner with food, nutrition, and provision of health services.
So there's a sharing from the Philippines. There's always be a collaboration. But maybe you want to share about PAUD HI in Indonesia?
Thank you, Dr. Chris. I'm so sorry. In the same time, I have meeting with Ministry of Education and Culture. Well, thank you very much for your question. My answer is in the rural areas in Indonesia, I mean, Posyandu is a leading sector for health sector. So training address of Posyandu for early childhood education activities will be beneficial for children in Indonesia. Thank you.
Yeah, so it is actually a system that already developed by Ministry of Education, and in some part it's actually working together between PAUD and Posyandu, ya Pak ya?
Of course.
Yeah. How about your observation, Dr. Ethel, in Southeast Asia country? Is there any other such movement of combining the integrated health posts run by the health workers with the ECE, which is run by educators?
This is only my personal opinion. There is no study. It would be good to have a feasibility study of that and how to combine both. And in Japan, it's already stated that it works well, right? But maybe we have different contexts and different government organization, and it needs a lot of consultation how to marry the two or how to integrate the two. But in principle, in the experience of the Philippines, they have the ECCE Council, and it's composed of different government agencies who are doing work on early childhood education. And in a way, they exchange their experiences, their programs, and as well as policy recommendations as one. So there is a top ECCE Council and coordinating everyone. This is a good model as well. But in the context of Indonesia, remember we had a workshop on ECCE, Teacher Competency Framework. So there are many things to consider, the people employed in both sector and so on and so forth. So I suggest we do a feasibility study for that and arrive at a very good recommendation for policymakers.
Yes, thank you. So another great idea for another research, yeah, Dr. Ethel.
Yes.
Okay, so I think if you still have some question, we have like 15 minutes left, or otherwise I will give back to Dr. Jess.
Okay, thank you very much, Dr. Grace Wange, for that excellent moderating of our Q&A portion for this session. And of course, a great appreciation to all our great speakers, Dr. Ethel, Dr. Dwi, and Dr. Dumlao. Ladies and gentlemen, you have heard different perspectives and experiences on how to strengthen ECE in Indonesia, in the Philippines, and also a regional perspective given by Dr. Ethel. It only tells us that if we have very clear knowledge of what is needed by our teachers and our stakeholders, and having a clear set of policies, guidelines, and implementation framework, plus a good coordination between and among sectors at all levels, we will be very successful in implementing any ECE program in the region or by country level. So once again, thank you very much to all our speakers. It has been a very enlightening session, and we are very appreciative of your time and your effort for the presentations that you have made. So ladies and gentlemen, it has been my pleasure to moderate this session. And before we end that, I think we would like to have a photo session for all the speakers and also the moderators. So Dr. Grace, please join us, and our staff from the unit, from the office, to take the photo for all of us.
Yeah, I'm keeping my mask on because this is part of our campaign of
Okay.
Okay, sorry for the unclear voice.
Yeah, and then just let us know whether it's already done, because I think Dr. Dwi has to attend to another meeting, and I believe the same thing with Dr. Ethel and Dr. Dumlao.
Okay, I will count. 1, 2, 3. Thumbs up.
Okay, thank you very much, everyone. This is the end of our session and the last plenary session of our conference. We thank all the participants for keeping up with us, and we will now proceed to the next portion of our conference. I will turn over the floor to our MC, Sasha. Thank you very much.
Thank you to our speakers, moderator, and also the co-moderator for the enlightening session. Ladies and gentlemen, we just ended the final plenary session of our virtual conference. Now, the time has come. We are going to announce Best Presenter, Best Poster Award, and Best Social Media Comment. To announce this, please welcome our Head of Scientific Committee, Dr. Helda Kusun.
Okay. Thank you, Sasha, for the nice introduction. Well, it's been 3 days of our conference, and we have on the second day we have 28 oral presenters, and we have 24 poster presenters. And also we invite all the time for social media comments. So after tight judging by all the distinguished judges, I would like, we are gladly announce the winner of all categories. First categories is for oral presentations. Okay, best oral presenter goes to Dr. Surabi Yadav from Symbiosis Institute of Health Sciences, Pune, India, with presentation title, Impact of Dietary Diversity on Nutritional Status of Indian Preschool Children in India, a systematic review. Congratulations to you, Dr. Yadav. And the first runner-up for
oral. It's
oral.
I'm sorry.
Okay, the first runner-up for the oral presentation is Widya Rahmasari. Widya Rahmasari is from Institute of Physical Activity and Nutrition, School of Exercise and Nutrition Sciences, Deakin University, with a presentation on pregnant women's views of antenatal nutrition education in Malang, Indonesia. That is the second. Okay, the second runner-up for oral presenter is Miss Desi Leo Ariesta from Sakanti Consulting, with presentation on non-government organizations played a role in reducing stunting in East Nusa Tenggara, Indonesia. We also have a special winner. The special winner is actually, we are really grateful that a lot of students are joining the conference. So we are giving the best oral presentation from students. The best oral presentation from students goes to Nurulita Rahmasari from Nutrition Study Program, Faculty of Medicine, Universitas Indonesia, with presentation on food accessibility and its influencing factors during COVID-19 pandemic in Indonesia. So that is the oral presentation. Okay, we goes to the poster presenter. Best posters presenters goes to Ibu Eli Rosida from Universitas Pembangunan Nasional Veteran Jakarta, with presentation on the effect of wheat substitution with sorghum flour and milk fish fortification on protein and omega-3 content of winning food. Congratulations, Ibu Eli. Next. The first runner-up for poster presentations is for Kadek Tresna Adi, Dr. Kadek Tresna Adi from Udayana University, Bali, with the presentation on the effect of complementary feeding recommendations and micronutrient powder on proportion of lactobacillus and bifidobacterium. Next. Poster goes to Sompon Noi Sukavong from Lao Tropical and Public Health Institute, with presentation on overweight, obesity, and associated factors among adolescents aged 15 to 19 years old in Pon Nong District, Vientiane Province, Laos. That was the all our winners for the oral and best oral and posters presentation. Congratulations to all. So everyone will all winner will receive special certificate for this. Now we are moving to the best social media comment. The best social media comments comes from, are we going to present the comment?
Yes, Dr. Helder.
Okay, the social media comment comes from Repa Kustipia at Repa Kustivia, which says that we have the recipe of yesterday with all the materials, procedure, and the after stage is feeling good and think creative. Thank you so much, Repa, for a nice post, for a nice and very compelling post. Yeah. So congratulations, Repa. And next, we have two best social media comment. The next is, this is it. So the feeling of manuscript rejection is probably harder than any rejection. So congratulations, Ami, Rahmi Mufida ya, at Ami Mufida. So you two will be contacted by the committee for your social media comment. So that's all for the winner for our conference. So I will give back the mic to MC. Thank you, Sasa.
Thank you, Dr. Helda, for announcing the winners. And also congratulations to all the winners. Your hard work are paid off. Okay, as we near the end of our conference, I would like to invite Dr. Jess to officially launch the maiden issue of SEAMEO RECFON's annual magazine called RECFON Awesome, as well as to give the wrap-up and officially close this conference. To Dr. Jess.
Okay, thank you very much, Sasa, and allow me to congratulate all the winners, best presenter, best poster, and also the best social media comment. These are very interesting, and definitely we will look forward to all these winners to be contacting us soon. Well, we have another special thing that we are presenting in this conference. Last year, we decided to have a magazine that will be easy to understand and can really benefit the general public in terms of food and nutrition. For the past several years, SEAMEO RECFON has been producing articles for journal publication, which only caters for the academe. But this time, and with the support of our governing board members from all over the 11 countries of Southeast Asia, we have now produced the maiden issue of our magazine we call Awesome. And why we call it Awesome? Because this is something that we would like to produce in one of our flagship program on Nutrition Goes to School. We would like to have active, well-nourished, and smart of me children. And this is also what we would like to produce and generate impression from all the public as they will be reading our magazine, Awesome. So we would like to officially launch this, and we will be launching it through a video, and I hope you will enjoy it.
My life, my story, starts a year ago with an idea. It's an idea that comes from a believer. The believer is my mother, SEAMEO Regional Center for Food and Nutrition, or most of you know her as RECFON. Mother believes that Southeast Asian countries share similar concerns, stories, policies, and even creative solutions for issues on food and nutrition. My mother has helped many scientific publications created and published, but still public are not informed of the science. Politicians are clueless on those achievements. So, the papers were left as it is, at the corner of the scientist's desk, dusty and forgotten. How can we change the science into stories that be easily understood and remembered? How can a story of stunting, wasting, and obesity easily understood by mothers, teachers, farmer, community leader, the regency officer, the ministers, and even random guy on the street? My mother thinks it should be another way, where all of us can easily understand and utilize those knowledges. We need to create popular science information to motivate everybody to work together solving issue on malnutrition in the region. That's, my friend, how the creation of yours truly was started. I was conceived on a roundtable discussion in the rainy city of Bogor on a lovely September afternoon. It was during RECFON's 9th Governing Board meeting. The members approved and endorsed the publication of a popular science magazine, Me. They agreed to name me, RECFON. Awesome. My name stands from A, from active, we, from well-nourished, S, from smart, of me. The word awesome was adopted from the expected outcome of the Nutrition Goes to School program that has been conducted by SEAMEO ECCE since 2016. During pregnancy, in order to grow her baby better, my mother gathered wishes from the public on how I should be later. A survey was held in March 2020 to find out the feasibility and accommodate hopes of prospective readers in Southeast Asia on me. Majority wanted a magazine to help them updated on the latest research in food and nutrition. My mother then opened up opportunities for those who wanted to contribute to the formation of my organs. A call for articles was held at the end of May 2020, and 14 authors have contributed. After sorting and choosing, 9 articles became part of me. The authors come from students, academics, and practitioners from the region and even far west from the United Kingdom. Now that I was a year old in my mother wombs. Are you ready to see me, my friends? Here I am. In my first edition, I go with the theme, Alleviating Stunting in Southeast Asia, Response to Post-COVID-19 Era. As main articles, we have 2 authors discuss on COVID-19 and how it affecting stunting alleviation program and activities. There is also some perspective on stunting and its related factors. As an update from the research field, I have 3 articles on latest research findings and innovations. I also cater opinions articles and have some practical infographics that can be used freely by readers. I am also updating 2 of my mother flagship programs, Early Childhood Care and Nutrition Education, and Nutrition Goes to School. Let's hear what the chief editor, who is also the director of SEAMEO ECCE, Dr. Mokhtaruddin Hanzar, says about me.
Dear readers, we heartily welcome everyone to be part of the leadership of our center magazine we call RECFON Awesome. This is our major issue, and we hope that you will find all the articles interesting and insightful for you. In July 2019, the idea of coming up with a regional popular magazine on food and nutrition came about during one of our regular monthly meetings. We are thankful to our governing board members for approving this idea during its 9th annual meeting in September 2019 held in Bogor, Indonesia. After 10 months of conceptualizing the format, contents, and procedure for calling for articles, selecting the theme, and going through the editorial and printing processes, we finally produced our first issue. For our first issue, we thought of focusing on stunting, alleviation, and Southeast Asia as the main theme. Stunting is a serious problem confronting our countries in the region. Many studies have shown that this form of malnutrition affects the overall physical, cognitive, and psychological growth and development of child. It determines the child potential for life in terms of school performance, ability to earn a living during adulthood, as well as susceptibility to chronic diseases. Fortunately, there have been several research programs and policies, trends and practices from various sectors toward addressing stunting in our region. We invite you to read and learn from every page of our magazine about stunting alleviation. We hope that you can share your reading experience to your family and friends. We look forward to hearing your feedback so we can improve on our next issue. We would also love to hear the topic that you would like to be featured in our magazine. In the meantime, sit back, relax, enjoy our magazine. Thank you.
That's all my story. See you when you download me freely from www.seameorecfon.org/publications. Let's have a fun time together.
Okay, thank you very much. Now you have seen the baby of our SEAMEO Center, and we would like to really encourage you to allow it to grow better by submitting articles. We will be having it on an annual basis of issuing it, and more or less we will be issuing it towards like a month of September, because we would like to time it also every time we have our governing board meeting. But before I turn over the microphone to the MC, I would like to acknowledge the efforts and dedication of our Knowledge Management and Policy Support Unit Manager, Dr. Grace Wange, for orchestrating all of this and allowing us to come up with a maiden issue, including this wonderful video that you have seen. And we hope you enjoyed it. Our first issue will be available in our website, Dr. Grace, but we will be also producing some print copies that we will be distributing to all relevant institutions and the authors and also our partners. We thank all the authors who submitted their articles, and we look forward to more articles to be featured in the next issue of our awesome magazine. Isn't it so awesome to have this kind of magazine? Yeah, Dr. Grace, do you have something to say more?
No, but thank you. The magazine, you can already read it in our website, www.seameorecfon.org. You go to the publications, it's already there. But for download, we will wait for maybe end of this month.
Okay, thank you very much. So just go and visit our website and click the link to our awesome magazine, and you will have the time and the chance to really read it. So that's all, ladies and gentlemen. This is one great event in our center's life, to have another publication on a regular basis to really communicate what's the trend and the issues and concerns and how we address them, to really have good nutrition among our children and even among us adults. Thank you very much.
Okay, Dr. Jess, we ask your willingness to give a wrap-up of this conference and also close the conference as well.
Okay. Yes, I will have to share my PowerPoint. Wait, just to give the wrap-up. Can you see the PowerPoint now?
Not yet. Yes.
Yeah, can you see it? Okay. So, ladies and gentlemen, it's my pleasure to give the synthesis and the closing remarks for our first SEAMEO International Conference on Food and Nutrition. We have heard several interesting and insightful presentations, and I hope I can do justice with giving the synthesis, the essence of each of the sessions presented, as well as those papers presented during the parallel session. Okay, it's not, okay. So I just have to mention about like, what is the unifying thoughts? What are the unifying thoughts that we can get from this conference? The conference only validates how complex and how continuum is the nature of malnutrition as a global problem that we are facing right now. And that's why everyone, really everyone in different sectors and levels of our society plays an important role in ensuring quality early life for productive human resources. It's not just like being an outsider. It's not just like watching from behind, but everyone has a critical role to play. And that's why, if you will recall in all the presentations, terms like holistic and integrated approach, multi-sectoral and multi-level collaboration, and even having target-focused interventions are mentioned every now and then, because this requires every one of us to participate and to be able to produce human resources that are quality and can really help improve our national growth and development. So when we go back to the sessions of the keynote address given by Prof. Ainon, our Secretary General called for the need to contextualize learning for ECD that would require holistic and integrated approach. That's why also in Indonesia, we have this kind of PAUD HI that is locally called here, that really applies holistic and integrated strategies to address issues and concerns on ECD. But in the end, the roles of parents is also emphasized that they are responsible to create conducive learning environment in the respective homes, particularly in this time of the pandemic. And if we recall the talk of Prof. Haggerty, and it's a very positive session, because he ignited a hope that epigenomics could hold a promise in exploring and discovering stunting nexus based on antecedents and underlying biology, so we can have appropriate intervention to address this concern in the future. And this is also, we're very honored as a center to work with him under the UK hub on stunting prevention in Indonesia, Africa, and in India. And we had interesting discussions of country experiences on plenary session 2 from Laos, Myanmar, and Indonesia. And what the session tells us is a reminder that despite this pandemic, we can turn all the challenges that we are facing this pandemic into opportunities in terms of strengthening governance at all levels, or strengthening multi-sectoral collaboration, and providing technical capacities to our implementers, and also making sure that our service delivery system is effective and efficient in tandem with monitoring and evaluation mechanisms. And last but not the least, we have seen the experiences in Indonesia, Laos, and Myanmar that there's a need to empower communities, for they are the frontliners in this pandemic to ensure the growth and development of our children. For session that follows, And this is also an interesting one because we heard a regional as well as a national perspective on food security. And Prof. Relio and Prof. Kitty emphasized the need to enhance public awareness as well as participation, and also adapting a holistic institutional approach to ensure food supply chain connectivity, the constant flow of goods at any level, and also food security to address all our nutritional concerns at the national level, at the community level, and even at the regional level, especially so during this pandemic when everybody is in chaos, where to look for food and how to access them and how affordable these food are for the sustenance of our respective families. For the next session, and this is all about the parallel sessions, we have 7 parallel sessions. But in general, what the parallel session tells us is it confirms that there is a wealth of information on various aspects of early childhood nutrition. At the same time, despite of this, there are more gaps to be filled up. That's why during the discussion just a while back, there are a lot of suggestions from Dr. Ethel or even in Dr. Dwi to really conduct more studies, feasibility studies or validation studies to see what are the best practices that we can adopt. So we need to identify, to consolidate and disseminate only relevant and practicable research findings in a way that our target users can apply them and understand them fully for sustainable purposes. So there are wrap-ups made by our rapporteur. Thank you very much for the efforts for all the parallel sessions, and I will be flashing them one by one. I will not be reading them one by one, but what is important to know is that there are so many things that are happening across the region in different levels and in different sectors, and we would like to capture all these things. We would like to really consolidate all the recommendations, and we would like to really disseminate this in a way that will be useful to you as our participants and for all those who have not been able to tune in our YouTube or in our Zoom platform, so you'll be able to know what transpired in the sessions and how we can really use them in the future for both research purposes and also for policy making purposes. Okay, so and we added something that is very interesting in this conference, and we have 6 hangout sessions given by very interesting and distinguished speakers also. And what these hangout sessions tell us is we need to adapt a lifelong learning attitude to discover more of our potentials. It's not just being confined in our desk, but to learn more about like how to avoid Zoom fatigue now that we are in this pandemic, and how to really teach school children, or how to have homemade food based for infant and young children, and even handling our manuscript and allowing us to be successful in coming up with a publication in the reputable journals. And lastly, which I also attended, is like nutrition influencer Basila on what's the best way to really reach out the most number of our intended viewers on our message for nutrition. So I believe you have enjoyed the hangout sessions, and I believe you have learned a lot also from these hangout sessions. So in closing, ladies and gentlemen, the first SEAMEO International Conference on Food and Nutrition is a manifestation of SEAMEO's steadfast commitment to our research and education mandates. For the past several years, as we have existed for 10 years, we have just been coming up with national seminars to disseminate our research results and even the research results of our grantees, because we see the importance of disseminating them. But that now it is region-wide, because we believe that we cannot just keep good research results in our files, but they need to be shared and they need to be heard by as many audience as possible. That's why this is a manifestation of our research and education mandates in SEAMEO RECFON. This conference is also a product of teamwork, collaboration, dedication, and courage among our staff and among our partners to venture on something that is beyond imaginable at this time of the pandemic. You would never believe how our team has been working almost 24 hours, exchanging messages in our WhatsApp, contacting our EO, and really perfecting everything. But we cannot do as much as we can. But we are able to bring you this first virtual international conference on food and nutrition without so much glitch. And we thank God for this kind of courage that He has given us to pursue this dream and make this dream come true. But in fact, this is also an expression of thinking outside of the box. As I have said earlier on, we have never thought of coming up and hosting our own international conference. But after 9 years or almost 10 years, we thought this is a time for us to have our own international conference. And maybe this is not really thinking out of the box, but venturing outside of the box, because it has been our intention to have this conference, and it already happened because of all of you. And we would like to regard this conference also as a token of thanksgiving and appreciation to all our dedicated partners and stakeholders, because without you, we will not have this courage and confidence to venture on this kind of activity. And we offer you this conference, our thanksgiving for this trust and belief in us that we can do it and we can all do it together. And lastly, we would like to regard this first international conference on food and nutrition as a significant milestone of our center. 10 years is too long. We have several milestones every year, but to end our second 5-year development plan this coming June next year, definitely this conference will be in the annals of our history as a milestone, a significant milestone for all of us. So with that, ladies and gentlemen, our great appreciation goes to the Ministry of Education of Indonesia, to the SEAMEO Secretariat, Dr. Ethel, and the rest of the staff of the SEAMEO Secretariat, to Universitas Indonesia, for allowing us to use your system for abstract registration and participants registration that facilitated everything for us, to SEAMEO CECCEP, Dr. Dwi and the rest of the staff, for your trust and confidence to work with us on ECCE and sharing all the things that we have come together and we have produced together. To SEAMEO TropMed, who has been our steadfast partner also, through Dr. Sandra and Dr. Pratap, for allowing us to have the papers presented from this conference to be published soon in the SEAMEO TropMed journal, hopefully early next year. To all our plenary speakers and moderators coming from all over Southeast Asia and beyond, particularly Prof. Haggerty, for waking up so early in the morning to just be with us, and our presenters from all Indonesia, Thailand, Myanmar, Laos, and the presenters, the paper and poster presenters from other countries beyond Southeast Asia. We are indebted to your participation for making this a success. And of course, without our participants, whether you are a paper presenter, a poster presenter, but just tuning in with us in our YouTube and our Zoom platform gives us the energy to continue on and really accomplish this momentous task of us of having this kind of virtual conference this year. And last but not the least, we are indebted also to our event organizer, Buati, and the rest of the team, because without you, we cannot broadcast this online conference. And there are glitches, but this is a part of the learning curve. And we are very happy working with you in bringing this conference to be a success. But I would not be fair if I will not acknowledge the commitment, the hard work, and perseverance of our technical and organizing committee members of this conference. I will not be able to mention them all, but I would like to credit the efforts and the leadership of Dr. Inda and Dr. Helda and Ba Arin for orchestrating all things in preparation since we start this year to make this conference a successful one, if I may say. And I welcome everyone and invite everyone to give us all a big virtual applause. So, what's the way forward, ladies and gentlemen? We would like to applaud the conference videos in CEMEO RECFON YouTube channel. Give us some time to do that. And I believe our Knowledge Management and Policy Support Unit Manager, Dr. Wange, is on top of all this. And together with our EO, there will be some editing in the process maybe before we can upload them in our YouTube channel for everyone to see and refresh and learn and relearn again by viewing all these videos. And like I said, hopefully by end of December this year, with the team and the editors, we would like to publish the conference proceedings. We call upon all the paper presenters and the poster presenters to please go over your papers again and see what else to be revised and to be improved before we come up with the proceedings by the end of the year. We are once again thankful to CEMEO TropMed for allowing us to publish selected papers that will qualify according to the standards of the CEMEO TropMed journal. And hopefully we will be publishing it, if not in February or in March for the first quarter of the next year. And this is something that we look forward to. And we will be contacting you once again, the paper presenters, for this process. And last but not the least, as much as we would like to bring an international conference on a yearly basis, but hopefully we can have the second ICFM in 2022 to give us more time to learn some lessons and gear up again and think about what's the next best topic for the next conference. And we hope to see you once again, ladies and gentlemen, for this next event. Thank you for making our first international conference on food and nutrition in virtual mode a successful learning experience. So on behalf of our director and the rest of the CEMEO RECFON family, I now declare the first CEMEO International Conference on Food and Nutrition officially closed. Thank you very much, and God bless everyone.
Thank you, Dr. Jess, for the beautiful closing of this conference, and also congratulations on the launching of RECFON Awesome magazine. For all registered participants, please don't forget to fill in the evaluation form, and the link have been sent in the Zoom webinar chat. Finally, the first SEAMEO International Conference on Food and Nutrition is now completed. Let us congratulate the SEAMEO RECFON and the ICFN committee members and event organizers for the successful conduct of this conference. We extend our heartfelt appreciation to all our distinguished resource persons and to all honorable participants for your kind attention. It was my great pleasure to be the master of ceremony throughout the first SEAMEO International Conference on Food and Nutrition. Let us all be guided by all the new insights and knowledge we have gained throughout this event. We hope that the conference has broadened our horizons about early childhood care, nutrition, and education. As we're still facing COVID-19 pandemic, please do wash your hands frequently and wear your mask. I am Izati Hayu Andari. Thank you. Good afternoon.